Hi everyone, welcome to the class on prostaglandins. So in this class you're going to learn about what are the important things under prostaglandins, what are the prostaglandin preparations which are available for clinical use, and what are the side effects. So myself Dr. Padmanabha TS, welcome to ilovepharmacology. So prostaglandins, you need to remember, so we have a membrane phospholipid, and with the help of phospholipase A2 enzyme it gets converted into arachidonic acid. So arachidonic acid will be moving into two pathways, one is the COX pathway and the LOX pathway. So lipoxygenase pathway will lead to production of the leukotriene C4, leukotriene D4 and leukotriene B4, which are the potent bronchoconstrictors, which are the inflammatory mediators. On the other hand, cyclooxygenase enzyme will lead to production of prostaglandin G2, and in turn it will lead to production of prostaglandin H2. And this prostaglandin H2, when it with the help of isomerase enzyme, they gets converted into prostaglandin E2, prostaglandin D2 and prostaglandin F2 alpha, and all of this prostaglandin E2, D2, F2 alpha has got effect on vascular smooth muscles as well as the smooth muscles on the uterine smooth muscles. And thromboxane synthase enzyme will lead to production of the thromboxane A2, which is a potent platelet aggregator, and also it causes vasoconstriction and also it leads to bronchoconstriction. On the other hand, we have a prostacyclin synthase which helps in production of the prostacyclin, that is PGI2, which is a potent vasodilator and it inhibits the platelet aggregation. So prostacyclin function and thromboxane A2 function are exactly opposite to each other. So prostacyclin has got protective effect, whereas thromboxane A2 has a negative effect by causing vasoconstriction, bronchoconstriction and platelet aggregation. So let us understand the functions of prostaglandin E2, D2 and F2 alpha. The prostaglandin E2 has got a very helpful effect on the gastric epithelium, as it protects the gastric layer from the HCl or the gastric acid attack. So prostaglandin E2 will help in the bicarbonate as well as mucus production, and it has got the effect on the platelet as well as the kidney functions. On the blood vessel it causes vasodilation. On the bronchial smooth muscles it causes bronchodilation. So basically on the smooth muscles they produce smooth muscle relaxation, that way you're going to see vasodilation and the bronchodilation. But with respect to the uterine smooth muscles, PGE2 will produce uterine contraction. On the other hand, PGD2 is responsible for vasodilation, but you should be very careful if a patient has say bronchial asthma, because it leads to bronchoconstriction. So prostaglandin F2 alpha, again it has got a very important function with respect to the eye. It is used in glaucoma as it increases the aqueous humor outflow through the by increasing the uveoscleral outflow, thereby it decreases the pressure inside the eye. And also it is a bronchoconstrictor. It should not be given in case of the bronchial asthma individuals, but the drugs which are used for treating the glaucoma are considered as a safe drug in case of bronchial asthma individuals. On the uterine smooth muscles, again it leads to uterine stimulation, thereby it helps in the parturition or the labor induction as well as in controlling the postpartum hemorrhage. So next, coming to the prostaglandins, basically the prostaglandins are involved in the inflammatory process, and these prostaglandins will be released mainly during painful conditions as well as during the fever. And the use of prostaglandins are contraindicated in case of inflammatory bowel disease as well as in case of inflammatory glaucoma, where there is a association of inflammation. So here the example is the anterior uveitis is associated with glaucoma. So why the prostaglandin analogs are contraindicated? Since the prostaglandin itself is an inflammatory mediator, and already these are the conditions where there is an increase in the inflammatory mediators already. So using of prostaglandin analogs in such conditions will aggravate the condition. So the adverse effect profile of the prostaglandins are very easy to remember. It can cause nausea, vomiting, diarrhea. Since it causes the uterine smooth muscle contraction, it can cause uterine cramps which can lead to abdominal pain, and it can lead to pain during injection. It can lead to fever, headache, and flushing due to vasodilatory property. And coming to the preparations, the prostaglandin preparations, we have prostaglandin E1. Under E1, you need to remember the three drugs, that is the misoprostol, alprostadil, and the gemiprost. So misoprostol is basically it is used to protect the gastric mucosal layer. They are used in the treatment of peptic ulcer disease, especially the peptic ulcer disease induced by the non-steroidal anti-inflammatory drugs, as well as in case of smoker-induced peptic ulcer. Apart from that, they are also used in case of cervical priming to induce the labor, and also to control the hemorrhage in case of postpartum hemorrhage, and also along with mifepristone, misoprostol is used in the medical termination of pregnancy. Whereas alprostadil, again a PGE1 analog, they are used to maintain the patency of the uh, ductus arteriosus. They'll keep open the ductus arteriosus till the surgery, and also it is used in the erectile dysfunction. So prostaglandin, that is the alprostadil, since it has got vasodilatory effect, so they can be used in case of erectile dysfunction. So gemiprost is a prostaglandin E1 analog. They are used for cervical priming. So whereas the prostaglandin E2, that is the dinoprostone, is used for induction of the labor, as it contracts the uterine smooth muscles, and also because of that property it can also be used for midterm abortion as well as postpartum hemorrhage control. Whereas prostaglandin F2 alpha, we have a dinoprost and the carboprost, which is a 15 methyl prostaglandin F2 alpha. They also used in case of mid-trimester abortion and control of the postpartum hemorrhage, as these drugs will cause contraction of the uterine smooth muscles. Whenever there is a contraction of the smooth muscles, the blood vessels between the smooth muscles will get contracted, and there will be vasoconstriction too, which will prevent the loss of the blood. So where are these drugs are contraindicated, or where are the condition where you need to be very careful while using such prostaglandin analogs? So since they cause bronchoconstriction, so you should be careful, and these analogs should be contraindicated if the patient has got the bronchial asthma. So coming to the special drugs which are used in the form of eye drops, that is the latanoprost, bimatoprost, travoprost, and uniprostone, which are the prostaglandin F2 alpha analog, which basically increases the uveous scleral outflow. That means they increase the aqueous humor outflow through by increasing the uveous scleral outlet. Thereby it reduces the pressure inside the eye. Thereby it can be used in the treatment of open angle glaucoma. So the adverse effects which are pertain to the latanoprost is they can cause blackish or brownish iris pigmentation, and also it can cause high lash growth, but it is safe in bronchial asthma. And when comes to the prostacyclins, that is prostaglandin I2, we have a drugs like ipoprostinol, treprostinil, and ilioprost, and a newer drug, that is the selexipag. All these drugs are responsible for smooth muscle relaxation leading to vasodilation, and they are used in the treatment of pulmonary hypertension. And treprostinil and ilioprost are administered through inhalation route also. And selexipag is a oral selective prostaglandin receptor agonist. So in case of second trimester pregnancy, if a female has got peptic ulcer, can we use a misoprostol? So can we use a misoprostol? No, misoprostol cannot be used because it can cause uterine smooth muscle contraction, and it can lead to abortion. And in a full-term primary gravida presents to a labor ward with labor pain, After 12 hours after labor progression, cervix is firm and not dilated. Which are the drugs to be given? You need to give a gemitoprost, which is a prostaglandin E1, or the misoprostol for the cervical priming, or it will going to soften the cervical part so that it will make a conducive environment for the induction of the labor. So after delivery of the baby, mother developed a PPH. What are the drugs which can be preferred? So you need to prefer the drug which can cause uterine smooth muscle contraction. So we have a dinoproston, which is E2, dinoprost, and carboprost, which is the prostaglandin F2 alpha, and misoprostol, which is a prostaglandin E1. So baby has got TGA, where you, for the surgery of the TGA, you need to keep the patent ductus arteriosus patent or open. To make the artery supply, you need to maintain the patency of the arteries. So that will be done by the alprostadil, that is PG E1 analog, till the surgery. And baby with pulmonary hypertension, you are going to prefer a prostacyclin analogs like epoprostinol, treprostinil, ilioprost, and selexipag. Apart from that, you should also remember the summary part also. The prostaglandins, you have got prostaglandin E1, E2, F2 alpha, and F2 alpha with respect to the eye. E1, you have got misoprostol, alprostadil, which are basically used in the abortion and peptic ulcer disease. Misoprostol is used in abortion and PUD. Misoprostol, while using in the case of abortion, they are used along with the mifepristone, whereas alprostadil is used to keep the patent ductus arteriosus open and also useful in erectile dysfunction. Prostaglandin E2 dinoproston is used for induction of the labor, as well as they can be used in case of the abortion and also to control the hemorrhage during pregnancy, that is PPH. So prostaglandin F2 alpha, dinoprost, and carboprost are also used in the treatment of the for causing abortion and the PPH, control of PPH. Prostaglandin F2 alpha analogs, in case of eye, we use latanoprost to control the eye pressure inside the eye. That is the condition where it can cause blindness. That is, they are used in the treatment of open angle glaucoma, where it increases the UV scleral outflow and reduces the pressure. So the prostacyclin analogs, they are useful in the treatment of pulmonary hypertension. The example are epoprostinil, ilioprost, treprostinil, and the selexipag. And again, the basic thing what you should remember is prostaglandin E1 decrease the vascular tone, thereby it causes vasodilation. Prostaglandin E2, they increase the uterine tone, therefore it causes uterine contraction. PGF2 alpha, again it causes increase in the uterine smooth muscle contraction. PGI2, they decrease the vascular smooth muscle tone, as well as they decrease the platelet aggregation. On the other hand, these non-steroidal anti-inflammatory drugs will going to block the prostaglandin production, thereby non-steroidal anti-inflammatory drugs will decrease the inflammatory process. On the other hand, this PDA, that is prostaglandin, will basically, so what is the effect of prostaglandin and the angiotensin converting enzyme inhibitor on the renal blood vessels? So prostaglandin will going to dilate the afferent arterioles, thereby they increase the renal plasma flow, they increases the GFR, and there is no difference with respect or no change in the filtration fraction. So if this function is inhibited by the non-steroidal anti-inflammatory agent, thereby it reduces the renal plasma flow, they reduces the GFR, leading to acute kidney injury. So when does this acute kidney injury occurs? Only whenever the NSAIDs are abused. So ACE inhibitors, angiotensin converting enzyme inhibitors, will basically constrict the efferent arterioles, thereby it reduces the renal plasma flow but increases the GFR, and also they increases the filtration fraction. So this was all about the prostaglandins. So you have learnt about the prostaglandin actions, the individual prostaglandin, how do they act, what are the prostaglandin analogs, where they are used, and what is the rationale behind controlling the use of NSAIDs for a prolonged duration of time, and what is the effect of prostaglandins on the renal blood vessels. Thank you.